Hi, I'm Eli. I'm 7 and I live with my mom and dad. I love to draw, play soccer, and play with animals, especially my dog Buddy. I'm in first grade. I would be in second, but I missed almost a year of school when I was 5 and had leukemia. Here's my mom and dad. My dad is really fun and likes to play soccer with me. My mom is really fun too, and she loves to read. I think even more than I do. She worries about me sometimes. I think because I was sick and in the hospital a lot a couple years ago. This is my next door neighbor, Alicia. She's 6 and she's in my class. She loves soccer too, and gymnastics. She does really well in school, has tons of friends, and she always seems to know how to solve a problem. She's my best friend. One day, my mom picked us up from school. We were going to our favorite park, and it was a sunny day. All of a sudden, the next thing I knew, I was in an ambulance headed to the hospital.
Events like this can cause trauma. In order to support the people who've been affected, it's important to understand what trauma is. First, it's an event that's possibly life-threatening to oneself or to someone very close, like a parent, grandparent, or sibling. And second, it feels like helplessness, panic, terror, or horror. And third, a person's body responds with an automatic fight, flight, freeze response that may include a really fast heartbeat, fast breathing, and feeling shaky, dizzy, or nauseated. These physical responses to trauma can feel scary and can cause someone to feel like their body is out of control, which can then cause even more panic. Perhaps you felt like this before, a feeling like your heart is beating outside of your chest. It's important to distinguish routine stress from more traumatic stress. For example, we're both a little nervous about my child's first dental appointment. It's very different from my child has just been hit by a car and I'm afraid he could die. Let's explore the differences. An acute trauma is a single event that lasts for a limited period of time. Examples include being in a car accident, being bitten by a dog, witnessing or being a victim of violence, seeing a loved one die. Other types of trauma, like neglect, abuse, caregiver physical or mental illness, or parental separation, may affect children over long periods of time. The reality is childhood injuries and illness are very common. About 20 million children experience unintentional injuries every year, and 5 out of 100 are hospitalized for a major acute or chronic illness, injury, or disability. The emotional impact of this is often related to how a person experiences a medical event and may be different for different people. Some people are very resilient and do very well regardless, while others may experience a similar event as overwhelmingly stressful. There are many factors that may affect how a person or a family experiences trauma, including, was it sudden or gradual? Was it painful? Were there any long-term effects on health? And were these effects obvious or visible to others? Were any other family members directly affected? How did the injury occur, in particular, if it was caused by another person?
I needed to have lots of tests and stuff done, like x-rays and a bunch of other scans, and met with a bunch of nurses and doctors. But then it turned out I didn't really need to stay in the hospital, so I got to go home. My parents thought maybe I should stay home from school, but I really just wanted to see my friends. I feel kind of badly because after school, my parents asked me if I wanted to go visit Eli, and I said, no way. I felt so nervous thinking about going back to the hospital, and it felt like it was just going to be worse if I actually went there.
I woke up the next morning. I guess I had surgery or something. My leg hurt really bad. I felt really confused about what had happened. I kind of remembered the car accident, mostly just how scared my mom and Alicia looked. Then I remember being in the hospital a lot when I was younger, when I had leukemia, and I was worried a lot about what was going to happen. Like, would I need to miss another year of school? So then, I didn't talk to anybody, except my mom. And I think I was really grumpy with her. Sometimes I worried about her too, remembering how scared she looked during the accident. I also had some bad dreams, but I don't really remember what they were about.
My parents explained more about what happened, and they said they understood why I wouldn't want to go visit Eli. And they also explained that Eli needed to see me, and that I needed to deliver the get well cards that our class had made for him. When I got to his room, he had some tubes and stuff attached to him, and his leg was in this big cast thing. Then he smiled really big and said, "I'm so happy to see you." I was so happy to see him too, and I was so glad to see that he was okay.
Every child reacts to trauma differently, and their response depends on a few important things: their actual age versus how old they seem to act and feel. Their temperament, for example, someone like Eli with a more sensitive temperament may be more vulnerable to the emotional impact of trauma, whereas someone like Alicia may be better able to brush it off. How much prior trauma they have experienced, because past trauma can make us more vulnerable to the impact of a new trauma. How dangerous your child felt the situation was. And remember, your child responds to your cues. So if you respond showing a lot of fear, your child may see it as more dangerous. There can be three main ways trauma affects children. There may be changes in physical arousal, meaning they may be more nervous or quick to startle. They may be more irritable, moody, or act younger than their age. Like Eli, they may have difficulty focusing or trouble sleeping. Like Alicia, they may have strong urges to avoid anything that reminds them of the trauma, and they may not even remember key parts of it. They may also vividly remember or re-experience the event, like sights, sounds, sensations, people in their waking life or in dreams, and younger children may act out the event in their play. During times of remembering, a person may appear spaced out. Let's also consider how we learn to manage the impact of trauma and build resilience and heal. Resilience is the ability to recover from traumatic events. In general, children who are resilient see themselves as safe, capable, lovable, no matter what. Resilience strengthens when children have at least one strong, supportive relationship with a caring adult, feel like their abilities and strengths are being recognized and nurtured, feel some sense of control over their own lives, feel invested in and a part of a larger community like their neighborhood, faith-based group, scout troop, or extended family. Some school-aged children or adolescents who have experienced trauma find that serving a cause can be healing. Alicia needed to stay in the hospital for just a short evaluation, and then she went home to her usual schedule fairly quickly. Alicia's parents helped to re-establish routines as much as possible. Regular meals and regular sleep schedules create the predictability and certainty that your child needs after an event that has seriously threatened their safety. Letting them know simply and honestly what to expect next in a step-by-step way decreases their worry about the possibility of more danger. Eli, on the other hand, needed to stay in the hospital for a bit longer. His mother stayed with him, and he appreciated hearing from his classmates. Connecting with family and friends can help people to recover from traumatic events. Giving attention and extra hugs can help ensure kids feel safe. Let children know that you are always available to listen and talk about their experiences and questions when they're ready to share. Next, we'll focus on how to help your child manage their natural desire to avoid trauma reminders. These can be anything that reminds the child of the traumatic event they experienced: a place, person, sight, sound, smell, etc. Avoidance of anxiety-provoking situations is a natural urge, but avoidance may prevent your child from participating in their routine activities and play, which may then keep them from progressing academically and socially. Therefore, it's important to be a reality check for your child and to help them to face these reminders even when they may not want to. By gradually facing their fears, they learn to realize that they can be strong, resilient, and less afraid, even after having gone through difficulty. Eventually, that trauma reminder may not cause any significant response. You can do this by asking them, is this really helping you stay safe? Or are you avoiding it just so that you'll not feel nervous? Sometimes it can be helpful to break things down into smaller steps and face each of these in progressive steps. Praise your child when they participate in safe activities that initially made them nervous.
It's been about 2 weeks since the accident, and I am feeling much better. I don't need as much pain medicine now, and there's this cool lady named Maya that comes in. She is a music therapist, and she always makes me feel better. This other therapist taught me about taking deep breaths, which my parents sometimes have to remind me to do, 'cause it helps me calm down. Oh, and I also got some cool toys from Child Life. At first, when I was playing with these cars and trucks, I kept making them crash. But after a while, I started feeling more like I wanted to do some other things, like reading books with my mom and getting started on my makeup homework. Normal stuff. It helped a lot too when I got those cards from the kids in my class and when Alicia came to visit. And my bad dreams just about went away too.
While Eli and Alicia are both improving, Eli's mother is still replaying the scene over and over in her mind. She blames herself for what happened. She feels constantly on edge, and she finds it hard to talk with Alicia's parents, even though they tell her they don't blame her. She's noticing that she can't concentrate very well, and she feels like her temper is short. She wonders whether talking with someone professionally might help. On the National Child Traumatic Stress Network website, she learns about a type of therapy called trauma-focused cognitive behavioral therapy, and looks into getting support through a therapist trained in this approach. The reality is that the majority of children and families do quite well and recover from traumatic stress. Interventions are aimed at building upon existing resources and strengths, family and social connections, co-regulation, and re-establishing rhythms. However, if symptoms of arousal, re-experiencing, or avoidance continue for more than a month, in a way that interferes with day-to-day functioning, it's important to seek out more support. Please see our video on how to access a mental health provider. The goal of therapy is to teach a person to regulate their body's physical and emotional responses through distress tolerance, coping, and grounding skills. After mastering these skills, the idea is to tell the story in order to make sense of it, gain mastery over it, and let it become a chapter in one's life so that their identity and personal story or narrative is one of resilience and not solely defined by their trauma.
I got home a month after the accident and finally got to go back to school. I was so happy to be with my teachers and friends again, especially Alicia. I still have to do some physical therapy, but I don't really think much about the accident anymore.